with that, I'd like to welcome Miles Romney, CTO and co-founder with platinum sponsor eVisit. And he's going to explore how virtual care is care. It's a kind of a 2050 vision of telehealth. I think if we're ready for Miles, he can take it away.
Hi, everyone. I'm Miles David Romney. I'm CTO, co-founder, and On-Staff Futurist at eVisit. I'd like to start by saying just a few words about eVisit, not by way of promotion, but rather to establish our relationship with the conference and with the topic, and because eVisit in 2020 was pretty well representative of the telehealth market at large. At eVisit, our vision is to simplify healthcare delivery to everyone, everywhere. This today mostly means that we facilitate geographically remote visits and hybrid workflows. But eVisit is a telehealth company in the same way that Amazon used to be a bookseller, and we're continually increasing the scope of our tools and our partnerships to provide more and more comprehensive solutions to the market's ever-changing challenges. 2020 was a busy year for us at eVisit, as it was for most of us here. We hit utilization of 12x our previous peak almost overnight. At one point, we onboarded some 7,000 providers inside of 10 days, and by year's end, we'd grown revenues by nearly 600%. We got into telehealth confident that an inflection would come. We didn't know it would be a pandemic, and we're sorry it was, but 2020 ended with America's health systems in a considerably more prepared position for the next major challenge than they were a year previous. We deeply lament the challenges and the loss of life imposed by COVID-19, but we do believe in making lemonade out of lemons, and we're pleased to have been a part of not only surviving the pandemic, but also in leveraging its lessons to future preparation for the future preservation of life and health. I'm also a writer, and I enjoy envisioning the future. I like to explore what the future is in danger of looking like if certain trends hold, and how brilliant it can be if we bring certain other forces to bear. We, most of us in this room, have the distinct advantage of being in a position in healthcare technology to be a part of solving what, by my lights, is the second biggest problem facing humanity today: the high cost and uneven availability of healthcare. So let's jump forward 30 years and see what virtual care might look like in the year 2050. What it will look like if I have anything to do with it, which I do, which all of us do. Imagine waking gently at 6 a.m., not to the buzz of an alarm, but smoothly by a process that feels as natural as can be, steadily deployed by an app in your micro implant. You stand and you stretch, you pass through the kitchen where you grab the cup of coffee that's already waiting for you. You stare out at the sun rising over the city, stretching at your feet, while you peruse a few headlines, not on a mobile device or a hanging display, but rather through an implant, either ocular or neurological. Then you walk into the bathroom, slip out of your pajamas, and step into the shower. Before the water starts, though, you hear the hum of a full-body MRI and feel the soft nipping, or maybe you don't feel it at all, of a half dozen instruments collecting samples and cataloging vitals. Results are analyzed real-time by AI and sent to your care team for validation. A transdermal infuser pushes a cocktail into your blood: vitamins, relaxants, painkillers, beta blockers, antioxidants, TNF inhibitors, even stimulants. Your coffee was decaf. All synthesized in response to your current blood chemistry and carefully balanced against one another. When the steam rolls up from beneath you and the hot water sprays down from above, you already feel like a new person. Your doctors were still involved. And when it comes time for a conversation, you'll have it remotely over video or VR. It's all at your fingertips, but you're only aware of it as you want to be, until a crisis hits, and when it does, the local infrastructure will exist to treat it, because your virtual care has largely been flowing through it, informing it, funding it. There's no taking time off of work to drive down to a medical center, no hassling with parking, no fighting to schedule with 5 different doctors, losing your lab order and having to drive into the clinic to get a replacement, no accidental drug-on-drug interactions or a drop in drug efficacy because of your own evolving chemistry. No. Many of your vitals are collected and monitored continuously through your implant. Others come daily when you step into the shower. All of them flow in real time through AI and your flesh and blood care team at a frequency and with a granularity that would be the envy of any Ferrari mechanic. Your body will be, as it were, a well-oiled machine. And we at eVisit predict that in the year 2050, we're not going to be employing any fewer doctors than we do today. Flesh and blood doctors are still going to be at the center of the care continuum, but they will be practicing at the top of their licenses, doing those things that are most effective to increase patient outcomes, while many other tasks that support them and prepare them are handled by machine learning and AI. What will this take? Well, it'll take a lot. We aren't close. Technology, economics, legislation, regulation, education, staffing, manufacturing, supply, there's a lot to do. It'll take time. And the whole village, as it were, the whole global village. No one company can do it alone. No 10 companies can do it alone. Have you heard the saying that nobody knows how to build a number 2 pencil? It's true. The graphite is synthesized at one manufactory, the eraser at another, that's pumice with rubber or synthetic, sometimes even vinyl. Clay is mined elsewhere. The wood comes from still somewhere else. The metal for the ferrule is mined and processed, and then somebody puts it all together and takes it to market. If a number 2 pencil requires a global supply chain, you can bet that the future of virtual healthcare will be an order of magnitude or 2 more collaborative, more distributed. But we're up to it. The more people in the world, the more innovation we've got. It compounds, in fact, with innovation per capita increasing as population increases. I'm an incurable optimist. Yes, the world has challenges, but it's always worth taking a moment to acknowledge what is going right. And there's a lot of it. Let's look briefly at what our innovation has wrought. Since 1850, that's 170 years, a drop in the bucket of our 6 million year human span. Our life expectancy worldwide has doubled from 40 to 80 years. In the last 60 years, the efficiency of growing staple crops like tomatoes and rice and wheat has doubled. Rockefeller University estimates that by 2050, owing to improved agricultural techniques, an area the size of India will be returned to nature. From 1800 to the present, almost a perfect inversion, from 90% illiteracy in 1800 to 90% literacy today. But over the last 60 years, we're working half as many hours. And in the last 100 years, our per capita energy consumption has halved. Now, this is measured in comparison to GDP, so increases in wealth are as much responsible as technical innovation. But John Constable's analysis from the Global Warming Policy Forum shows that although the UK's economy has almost trebled since 1970, and the population is up 20%, total, not per capita, but total energy consumption has fallen by nearly 10%. Innovation at work. And though we've now some ground to make up for after this last couple of years, 1993 to 2015 saw violent crime drop by a whopping 84% in the United States. We live in the greatest time in the history of the world. We have more peace, more freedom, more prosperity, more education, more longevity, higher energy efficiency, higher quality of life than ever before. But we have our challenges: growing debt, growing cost of healthcare, growing cost of education, growing urban crowding, growing transportation costs, increased environmental strain, persistent racial and class inequality, and a number of other problems that are all very difficult and some of them existential. Possibly one of the greatest challenges, if not the greatest, that we're dealing with today is that we have higher expectations than ever before. Well, virtual care is in a brilliant position to leverage the world's greatest assets against its most dangerous liabilities. Now let's talk a little bit about virtual care. We at eVisit don't much like the word virtual. I typically don't like appealing to the dictionary, but here it'll serve. If we look at the word virtual in the OED, we find that the first 2 definitions intimate something fake or imitated. It's not until the 3rd definition that we get to a reference of computers and networks. We don't buy virtual books from Amazon, we don't get a virtual degree from Harvard Online, and we don't get the virtual credit from Chase.com. Now, virtual care is simply care. And if we look at Gartner's prediction for 2022, next year, 30% of all ambulatory encounters will be virtual, up from 2% at the start of 2020. Telehealth, remote care, virtual care, in a few years' time, in the minds of providers and consumers alike, it will simply be healthcare. The line between remote care and on-site care will continue to blur, and most, if not all, long-term health and wellness care will involve hybrid workflows, with some treatment occurring in clinic and some remotely. Now, telehealth in its most basic form has been around as long as communication and any notion of remedying infirmity. What we're really talking about when we say telehealth are structured encounters. Gartner buckets these into 4 areas: virtual visits, digital clinical encounters, remote monitoring, and virtual consults. Over the last 100 years, at least the first and the last, have been carried out informally using any of 100 devices. When we talk about structured encounters, we mean healthcare delivered in a systematized way that leverages the strength and scalability of clinics and hospitals to maximize patient outcomes and minimize cost. Sure, you could have a conversation with a patient on a park bench under God's blue sky with the dogs barking, the ducks quacking, a bit like an unstructured encounter over Zoom or Teams. But in order to leverage the strength and scalability of clinics and hospitals to maximize patient outcomes and minimize costs, the virtual clinic should be as feature-rich as the physical clinic. It should also plug patients into care teams that can keep them healthy from cradle to grave through facilities and networks that can effectively integrate in-clinic and remote care, so that no single episode is viewed in isolation, but rather as a meaningful part of a lifelong whole. As the industry transitions from episodic care to population health and capitated models, this becomes not a nice to have, but a must have. In 2020, over 20 million patients were routed to remote call center healthcare providers they will never see again, that knew nothing of their health histories, had little to no visibility into their health futures, and could not but treat their immediate condition in isolation of their long-term health and wellness. This brings down patient outcomes, reduces efficiency. Episodic care is not holistic care. This presents us, all of us in telehealth, with a foundational challenge. Do we set ourselves up and use our resources to enable existing healthcare infrastructure, or do we stand ourselves up in competition with it? If the latter, how do we facilitate hybrid workflows and holistic care? No one yet has a really strong answer to that question. So at eVisit, we're doing the former, enabling IDNs and other provider networks who have already proven themselves to be in the best position to care for patients, putting next-gen technology into their hands so that they can not only continue caring for patients, but also take that care into the future with improved outcomes and greater efficiency. Something like this transition from on-site to remote and then into hybrid workflows has happened before in the consumer space. It was banking. The ATM came on the scene in 1967. By the close of 2016, 3.5 million ATMs, automated teller machines, had been deployed across the world. That represented a 30% increase over just 3 years prior in 2013. These machines enabled over 100 billion cash withdrawals, which was a 25% increase over 3 years earlier, whose estimated total value was $14 trillion. Think about that for just a moment. These machines, 3.5 million machines deployed in 2013 across the world, over 100 billion transactions valued at $14 trillion. Whereas a few decades earlier, the ATM hadn't existed at all. These estimates suggest, incidentally, that there are approximately $100 billion sitting inside ATMs around the world at any point in time. I read an anecdote that struck me in the book Cash and Dash, A History of the ATM. It goes like this. Tom from Adelaide remembered driving a truck and seeing 10 or so people standing outside a bank in very heavy pouring rain, waiting to get their cash at an ATM. He could not but laugh because, due to his high position in the truck, he could see over the frosted window into the bank where 4 or 5 bank clerks were doing nothing. This strongly suggests that consumers prefer structured encounters. That if we give them the option of a structured encounter and make it more convenient and optimally even make it less expensive, they'll go with it more times than not. Now, let's acknowledge that ATMs are simple dispensaries. Imagine requesting cash from an ATM and expecting it to know your budget, know the wisdom of your withdrawal and what you plan to do with the money and how that expense is going to interact with your finances at large and predict whether it'll push you into higher earnings or into overspending, and that it has real-time sensors into your home HVAC system, your pool plumbing, your roof, and your cars, and it knows how likely the need for emergency funds will be. That's more on a level with what we're all looking to build in healthcare. But though it doesn't yet rise to the level of what I've just described, the ATM has grown into other things. Before too long, it was accepting deposits, then mortgage payments, then even balance transfers, which led to the full-featured mobile applications we enjoy today, which do everything from household budgeting to person-to-person funds transfers. A complete set of financial tools. I myself had over 100 transactions with my banks last month. Not a single one of them involved a trip to a bank branch, and only 2 of them involved an ATM. Now, in healthcare, we're tasked, all of us, with leading the charge in transitioning the concept of a patient into the concept of a consumer of healthcare services. It's our job, all of us in health tech, and most especially those of us in telehealth, to bring all, or as many as possible, of the functions of on-site care to the consumer, into the palm of her hand, make the point of care wherever she is. This is going to involve new hardware technologies, new communications protocols, new security tools, new behaviors from consumers and healthcare providers alike, to say nothing of the user interfaces and user experiences that will need to be built. But we're getting there. With tools like eVisit and many, many others in this industry, we can now do everything from registration to intake to health history maintenance to telemetry and remote patient monitoring, copay and coinsurance calculation, credit card billing, prescription management, chronic condition maintenance, machine learning-based risk screening and analysis, daily health tracking and reminders, advanced patient routing and workflows that involve seeing maybe half a dozen healthcare staff, and much, much more. We're still a ways away from it, and getting there will take many tens of thousands of us working together. But we are approaching the day when I can step into the shower and outsource my healthcare to a team of qualified professionals without giving it a second thought. The future is ours to create, us, in this room, on this call. It's up to us. Let's make it happen together. Thanks so much, everybody, and enjoy the conference.